actually. It went to Catholic Health for their food insecurity program. And, the pandemic, there were so many negative things that we can attribute to the pandemic, but I think one of the positives was an awareness of some of the needs in our community that have been there for years, that kind of were under the carpet, so to speak, and the pandemic allowed it to come forward. And one of them was food insecurity, and oftentimes there are seniors that are suffering from that, and the hospital took the lead. Catholic Health took the lead, and they have this program that works out of the emergency room. People are coming in. A lot of times you'll see that they're exhibiting symptoms of food insecurity, and they actually have to-go bags of food for them. And Good Sam in particular has taken this a step further and are bringing it to our senior centers, are bringing it right into the community, and they'll be in the centers. I mean, the center we're in here today, they're basically home for the day now, but we literally have 100 people at least here every single day, and are taking advantage of our feeding program. But this will be that education component, and we will probably see people on the spot that do need that little extra, and they'll have that to-go bag.
As a faith-based health system, we do provide exceptional health care, but we also are very much connected to the communities we serve. And social determinants drive over 72% of chronic disease burden. And so when you look at the Long Island market, food insecurity is actually a major player in development of chronic disease. And you may say, well, how is that possible? Well, in today's day and age, it's never been a time like this where the most calorically dense yet nutritionally depleted varieties are actually what people can afford, right? And if you look at the variety of fast food chains that are out there, you can get a special kind of meal for a few bucks, but it clearly leads to things over time such as hypertension, hyperlipidemia, heart attack, stroke, again, still the biggest killers in our country. And when you look at our numbers, over 218,000 Long Islanders, that's Long Island, have reported at one point in their lives to be food insecure. 80,000 children, and another big chunk of seniors. That should never be. And so what we've done at Catholic Health is actually built in the ability to screen for food insecurity in all of our emergency rooms. For those of you who know me, I am an ED doc, and I've worked in many of our emergency rooms before this incredible opportunity. And so we view our emergency rooms as islands of hope, where people can come in when they have an emergency or they have a need, but to ask the questions and to screen them. And if they do screen in for being food insecure, all of our emergency rooms actually have go bags of food, and want to recognize and thank our partners at Long Island Cares and Island Harvest and Catholic Charities. Everyone has been involved with helping us develop this program. We could actually give people, if they screen in, food for they can go home with for a couple of days. And then we work on a warm handoff, and we plug them in to community-based programs that are available at Catholic Charities or Health and Welfare Council of Long Island, so that they can roll in programs such as the Supplemental Nutritional Assistance Program, or SNAP, and actually get some degree of subsidization so they can go buy healthy food and not be food insecure. So we are very hopeful that this will begin to make an impact and start to bend the chronic disease curve by keeping people healthier. And we're very excited about it. And we're even looking at new innovative ways that we can actually engage members of our community in meaningful employment, growing some wonderful fresh food. So we've recently partnered with Smile Farms. Very excited about that. We'll be building a cooperative, small but a cooperative farm, where members that are being a part of Catholic Health can actually help produce good, healthy produce that we will then donate back to food banks so that there's more fresh food available. So working with Supervisor Carpenter has been just wonderful in town of Islip. Where we have similar partnerships with other towns and municipalities. And again, part of our mission is really to connect in and improve the health of all the communities we serve, and we're doing that at Catholic Health.
So we made a $50,000 donation to Catholic Health to help fund their food insecurity program. It's for us, it's just a measure of how much we care about the community, right? We talked a little bit before, but there's just thousands and thousands of people in Long Island who are food insecure, and hopefully our donation will help to solve that for a few of them.
So really, we can't thank Good Samaritan and Catholic Health enough, and certainly AT&T making the $50,000 available for this very, very needed, very, very worthwhile program.